against you. So I will say more than that.
So headphones. Please try to speak into the mic as much as possible. It's not compulsory. You don't have to, but surround
Yeah.
sound effects.
Okay.
Yeah. Oh, yes, you can bet we rely on each other. We rely on you to be locked on to Smooth 98.1. You love music. We definitely love life. It's a beautiful hump of the week Wednesday morning. You're getting on about your day. You're listening to the Smooth Breakfast, and we appreciate you for keeping it tuned each and every single day. My name is Ayokunmi Kekereakun. And it is that time, Lagos, to get into the world of conversation. We love to talk. We love to have dialogue backs and forths. Get your thoughts, your feelings, your opinions, and just feel your pulse, more or less. We share knowledge as well and just try to make sense of everything and anything that is going on. This is Lagos Talks once again, and today it's going to be a special. It always is a special. Hey, what am I saying? That's what we do. That's how we love to do it. We're going to be talking about childhood cancer this morning. And you're probably wondering why. Well, the month of September is billed as Childhood Cancer Awareness Month. And the onus is on us to have these conversations, bring these discussions to light, to the fore, and just let you know what is going on, what is happening, why it's happening, what we can do to make life a whole lot better. And that is why we sit down every morning at 9 o'clock, Smooth 98.1, to talk about these things and, just make some sense, basically, of everything. And like I said, today it's going to be all about that. We're going to be having amazing guests in the studio this morning to talk about this. First of all, I have with me in the studio a wonderful pediatrician and, of course, a man who has been doing amazing work in terms of bringing awareness to the plight of those who are living with childhood cancer and the strides that are being made in that regard. And what we can also do more to also make it easier for those who are living with this and just to open our eyes to what's happening within that space. But you know what they say, ladies first. My pediatrician with me in the studio this morning is Dr. Oladunni Okodugha. She is a pediatrician. Very good morning to you, Dr. Oladunni. Great to have you on
Good
Latest Talks.
morning, Ayo. Good morning.
And my second guest this morning is from the Dorcas Cancer Foundation, TDCF. He is the Director of Programs and in the person of Korede Akindele. Very good morning to you.
Good morning, hi. Good morning, Nigeria.
It's a pleasure to have you both in this morning. And first of all, I will say big ups to both of you for what you do in terms of helping everyone out there and just keeping the wheels of life going along. It is amazing, despite the challenges, because we know that there are challenges that you face on a daily basis. So I had to start on that note, doffing my hat. Even though I can't take it off right now because the headphones are on. But anyways, you can join us on the conversation this morning by sharing your thoughts on 0809 440 981. 0809 440 981. That is the WhatsApp number. You can also join us on YouTube. We're streaming live at Smooth 981 FM Lagos. And you can see all the interesting behind the scenes things that go on in the studio. So let us begin from this perspective or this point of view and talk. I'm coming to you, Dr. Oladunni, on this one.
Yeah.
When we talk about childhood cancer, now, a lot of people, when they hear cancer, they don't really think of children. You hear cancer, you think about, oh, an older person. Oh, how old was he? Oh, how old was she? It doesn't usually come to the mind that, oh, children as well actually deal with cancers. I mean, cancers do not respect age. It cuts across all demographics. It cuts across all age groups as well.
Mhm.
And it's really important that we put the spotlight on it, which is why we're here this morning. Now, I need you to just hold on to this question. I'm going to ask you right now. What's the prevalence of childhood cancer in Nigeria, and what exactly is being done to improve the outcomes? And I want you to marinate on that particular question. When we come back in after this quick breather, we'll jump right into the conversation. Lagos, this is Lagos Talks. Keep it tuned. Smooth 98.1. Don't go anywhere. So I just wanted this ad to play because if we jumped in, the ad would have been delayed.
Oh, Oh, okay.
Yeah, so I had to stylishly push it forward.
Yeah. Okay.
So it's about it's 2 minutes.
Have you done really before?
Sorry, I've not done.
Yeah, no, I told her you'll be fine. So just project.
Yeah. Okay. Project.
Just project and
Yeah.
just talk. I mean, this is your playground.
Yeah.
This is Messi at Camp Nou. It's your home.
Mm-hmm.
Just think about it that way.
Yeah.
Or in lady terms, whatever it is that works for you. I don't know what actually works for you. Maybe it's Lee Min Ho in his K drama, whatever. I don't know.
Yeah.
Whatever works for you.
So you said what we're doing to improve outcomes?
Yeah.
My first experience. That was my first experience on Arise Network.
Oh, really?
Oh, TV straight up.
Oh my gosh.
Ah.
It was when they were still in Apapa.
Okay.
That was it. So we went, me and Dr. Joseph. I just went and like, okay. Ah.
Go that
And I
way.
see. And that was
TV.
it.
It's a different ball game.
And that was it. I mean, TVs. I mean, I've been. I mean, doctors have set me up a lot of times. I've been on TV, Arise,
Yeah.
TVC.
I don't know. I have this thing where TV is concerned. Where do I actually want to do TV? Because it is you are cast to the whole world. I mean, here I can wear my slippers and shorts, and nobody is going to know. I can pick my nose if I want to. But on TV, any single thing you do, spotlights.
Especially these times of social media. Someone would pick what you never.
Yeah, said.
You don't see yourself on Twitter, a recorded video. Someone has done a recorded video and posted it. This guy, that's what he's doing. They said, no.
No, it's been a good job. I'm telling myself, I'm going to retire media. Get some people really. But I mean, we are grateful. I mean, we're grateful to the small FM. Because I mean, giving us a platform for 6 years is not a big.
Because when Miriam told me, I didn't think twice about it. It even makes my life easier because that's one less day to worry about Lagos talks anyway. So
from Ayo, the days of Ayo that is on the last TV.
yeah, I am my
Ayo,
wrestling.
and the other guy. They were two presenters.
Rotus as well.
No, I didn't know that. I think what was the higher period?
No, I think it was it Valentine?
Valentine.
Yeah, I think it was Valentine.
Like 2
I
years together.
I didn't meet them, but I
Yeah, Ayo and Valentine, and then Shopper.
yeah, Shopper was here till last year.
Yeah.
Shopper was here till last year.
We had Shopper then. So my friend, thank you.
All right, welcome back to Lagos Talks on Smooth 98.1, where we love music, we love life, we love great conversations as well. It's a hump of the week, Wednesday morning. My name is Ayokunmi Kekiriakum, and we're having a Childhood Cancer Awareness Month special and looking at childhood cancer as a national priority. That is where we are this beautiful, beautiful morning. My guests are still in with me in the studio. The person of Korede Akindele, the Director of Programs at the Dorcas Cancer Foundation, that's TDCF, and of course, my pediatrician for the day. That's Dr. Oladunni Okodugha. She is a pediatrician registrar at the Pediatric Oncology Unit of the Lagos University Teaching Hospital. That is the LUTH. Great to have you both back on the show.
Yeah, good
this
to
morning.
be here.
An absolute pleasure. So we dove into the conversation talking about childhood cancers, and from my reading here and there, it refers to cancers that occur in children under the age of 15. And they tend to be different from the adult cancers and all that. I didn't go to medical school. Let me not try to feel myself too much, just try to show. But before we went on that break, Dr. Oladunni, I was asking you about the prevalence of childhood cancer in Nigeria, and what are the things being done, the steps that are being taken in order to improve the outcomes?
Okay, thank you, Aya, for the question. Honestly, childhood cancers in Nigeria are under documented, but
Okay.
it's been estimated about 40,000 children per year come down with childhood cancers in Nigeria. Globally, it's about 400,000 to 500,000 children per year. So it's
Wow.
quite, yeah, it's a problem. So although we have like underreported cases, but yeah, it's estimated to be about 40,000, 50,000 a year in Nigeria.
Hmm.
So things are improving honestly in childhood cancers compared to about 10 years ago. We have made a lot of stride in treating childhood cancers. It's important to know that childhood cancers are actually curable most of the time
Oh,
in developed world, in the developed countries like the USA. We have cure rates about 90%, 80 to 90% in most childhood cancers. In Nigeria, we're still about 30%. We're doing better. It's getting better. But we still have a long way to go. So it's not a death sentence anymore. We have treatment, we have chemotherapy, we have radiotherapy, we have immunotherapy, we have things, support, blood support, blood products like platelets and all of that we need to help children with cancer. So the support care is getting better.
okay.
Compared to 10 years ago, honestly, we have made a lot of stride. We have people going into getting residency certifications and training in pediatric oncology. And they're doing amazing things. So it's just getting better and better by the day, and we hope to improve as years go by. Yeah.
That is something really good to hear that things are getting better
Yeah.
and they are improving. This is coming from someone who's on the front lines
Mm-hmm.
doing what she knows how to do, and that's of course uh, treat and make sure that kids feel a whole lot better. They're healthy
Mm-hmm.
and they're full of life as well. I'm going to come to you right now, Korede, but before I do that, for all our listeners out there, join us on the conversation this morning by sharing your thoughts on WhatsApp. The number is 0809 440 981 0809 440 981. That's the WhatsApp number to share your thoughts on. You can also join us on YouTube. We're streaming live at Smooth 981 FM Lagos. Smooth 981 FM Lagos. All right, so Corey, so let's talk about the challenges facing childhood cancer care in Nigeria. And I mean, looking at what you do at the Dorcas Cancer Foundation, what are the challenges that are actually facing cancer care in Nigeria, childhood cancer care in Nigeria specifically, and what are the things that you and TDCF are doing in order to address these issues, particularly in terms of early detection and the access to treatment as well?
All right. Thank you so much. Ayo. So, in Nigeria, challenges of childhood cancer, like you said, it's different from what we were saying 10 years ago. But let me begin from the lowest. One of the greatest challenges of childhood cancer in Nigeria is awareness and education. And when we talk about awareness, and education, we are not just talking about to the general public alone. We are even talking about to healthcare worker, people
Okay.
working at the primary care level of care, which is very, very important when it comes to early detection of childhood cancer. And for us at the Dorcas Cancer Foundation, what we've been able to do is to set up a program, an education program, to aid early detection of childhood cancer. And we moved what we did is we set up a program that we call the Look Again program training program. The Look Again training program, for everyone. It's a general thing in Nigeria. When you're sick and you go to the hospital, what was the thing? Everybody is that malaria, typhoid. That's it. But what we have
Yeah.
seen in the process, in the times that we worked together, is so many children have come with these symptoms, and then after a long period of time, somebody said this, and then we are seeing this and this. So one of the things that we have done to solve education and awareness in terms of healthcare worker now, it's the Look Again program. So we go down to the primary care level. And
Okay.
what we are doing there is to train these healthcare workers working in the primary level on signs and symptoms and referral process. So
Mm-hmm.
this training is not training them to treat or to diagnose cancer. Is to see, when you see these, refer. Every one of us know that when a child is sick, I mean, when you go to the hospital, primary care, the next level they refer you to is what? Secondary care.
Right.
But with this training, we have removed the bottleneck of that secondary care. That when you see these strange things, instead of you saying go to this place, refer directly to tertiary institution where this child can. So that's what we are doing about awareness and education, and also funding is a critical challenge. The truth is, the treatment of cancer is not cheap, and
Oh
everywhere in
yes.
the world, that's the truth, and that is where Dorcas comes in. And then we've been able to, I mean, this we are 9 years in this
Amazing.
journey,
Amazing.
and we are doing our rehearsals, and then we've seen the money has been that's by the help of Nigerians and supporters that has gone into care. And through that, we set up a program that we call TAPS, Treatment Access and Pathway Support. Treatment access. And what we are doing is, one of the things this sticker is direct funding of treatment. And within 9 years, we've been able to work with over 100 children through direct funding of treatment that we take on board a child, and also through different means. And that is what we are doing with, and we also have under the donation of consumable, medical consumable boxes. So every time we go into the ward, we go into the ward with these boxes to see there is somebody that needs this thing. So what we are doing is, because just the hospitals are providing, but we need, I mean, these children, they need more. And for us, we try as much as possible to add more. So through our TAPS program, we are reducing the burden of care, direct funding, and also what we just bring out, because we what we bring out this year is a program we call the Home for Treatment program. Because one of the key challenges also, and what we realize for treatment abandonment, is when people travel in. For example, somebody is coming to Lagos for radiotherapy treatment, where to stay in the process of 3 weeks. You
Right.
see
Right.
these
Right.
parents sleeping on the floor. I mean,
Mm.
I have witnessed a mother sleeping on a wooden chair.
That is so not comfortable.
For that is not comfortable for 6 months or through the treatment.
6 months.
More than, it's, I mean, she's a pediatrician. I mean, and so what we try to do this year is to set up a program that we call Home for Treatment program.
Okay.
So
Okay. Uh-huh.
when you come to the hospital and your child is in care, so we are partnering with hotels and shotlets around the hospital to say, you know what, if two family comes, maybe father and mother is with the child, okay, they can rotate. The father sleeps all night in the hospital, and the mother have a place to rest.
Okay.
Okay, they are coming for radiotherapy for 3 weeks. Okay, after the session, they can go to a place to rest as home for that short time of period. And so we are reducing the burden of, oh, I don't have transportation, oh, I don't have a place to stay. So if you are going to stay in the hospital, have this radiotherapy for 3 months, 3 weeks, you have a place to stay. So Dorcas is stepping into that. And that is a new program that, because yes, we are funding treatment, you have to call them, have you come, say, "Hey, there's no place to stay." Okay, fine. Then we key in there. So TAPS is one of the ways that we are reducing the burden of finance for access to treatment. So in the area of awareness and education, we are using the look again. And also, when we are realize that, okay, we've trained you, you've referred. How does this training, how does the treatment started? And then we
Okay.
now jump a little bit higher to kick off the early detection and initiation of cancer treatments,
Okay.
which
Okay.
is so important. Because when you have referred, okay, I've referred to her now. Okay, they've referred to her, they've called us that we've referred, and we've called, okay, how do we start treatment? So Dorcas step in there to make sure the diagnosis is being done early, the treatment start early. And so that's what we are doing to reduce the burden. But the challenges of funding is still there. The challenges of awareness is still there. And that's why we are grateful to Small FM for always giving us this platform every September to allow the general public to know that childhood cancer exists and is curable if it is detected early.
Early detection, like for many ailments out there, once it's caught really, really early, the chances of beating it and, of course, living a healthy life is very, very high. And of course, we know how a lot of Nigerians tend to behave when it comes to healthcare. Something is wrong. Just use paracetamol for it. Just go to the pharmacy, you'll be fine. That attitude to actually seeking medical care, it's something that needs to also change. And that is one of the reasons we do these things, to sing it, to beat the drums, and put it out there that when you see something, in this case, you really need to say something as soon as possible
Look again.
to your medical professional. I need to add that caveat. We'll continue this conversation on the other side of a very quick breather right here. Lagos Talks on the Smooth Breakfast on Smooth 98.1. My name is Ayokunmi. Don't go anywhere.
Any other one that you went for, and then that question was,
Good question.
what are you doing? But funding is critical.
It's critical.
Lagos
It's
is better.
expensive. Yeah.
Lagos is better. Just because of time, I was in UCH one time, and I feel like crying.
And the fact that people have to travel from Abuja, Kano, like
Lagos, they sleep there, I mean, on wooden chairs and plastic chairs. Iron, you know those days of iron chairs.
I mean, to sit in this chairs for half an hour is bad enough.
Not to not say
Yeah.
somebody sleeping there for months.
I mean, that could even lead to another problem for that person at the end of the
tell
day.
you that the mother of the child, Joshua, after, I mean, unfortunately, the child passed. She was at the point she was limping. In fact, she's limps now, and it was as a result of that
Inconvenience.
that
Yeah.
inconvenience, and also now going around the hospital.
Caregivers don't get enough attention.
No.
Yeah, and that's why we for us, I mean, like I said, we just want to start this supporting treatment, but now we've seen that
Even supporting the
that one is not.
caregivers.
Caregivers is part of our program now.
Oh, yeah.
There's one of my patients, they've been here for like a golden, I don't know if it's golden,
Yeah, I know God.
for a year, like away from his business.
Very bad, yeah. Things are happening.
Well, don't be scared, and that's why we always say it's scary.
Welcome back to Lagos Talks on a beautiful Wednesday morning on Smooth 98.1. Love music, love life, we love health as well. We're having a conversation concerning that. We're talking about childhood cancer this morning. Yours truly is Ayokunmi. My guests are still in with me in the studio. Dr. Oladunni Okodugha is the pediatrician on call this morning in the studio, as well as my other very, very special guest in the person of Korede Akindele. He is the program's director at the Dorcas Cancer Foundation. Great job you all are actually doing. For all our listeners out there, join us on the conversation this morning. Share your thoughts with us, any experiences, any questions you have, because this is a very golden opportunity to ask any questions that you might have, any myths that you've heard of before, because Nigeria and myths are 5 and 6. Yes, rub some oil on it. Rub some breast milk on it. I had a conversation last week with an ophthalmologist, and I heard breast milk is rubbed in children's eyes. I never knew that was a thing, but this is Nigeria at the end of the day. So send those messages in on WhatsApp 0809440981. You can also give us a call. Yes, I will open the phone lines. Give us a call on 0201 4489 981. Now, if you have trouble getting through on the studio line, you can call us on the WhatsApp line. So there are 3 ways. You can call and send messages on WhatsApp. You can also call on the studio line as well. We'd love to hear from you this morning. Okay, back into the conversation. I'm going to come to both of you on this one, but I'll talk to Dr. Oladunni first about this. And I'm just wondering, it's about policy changes. Have there been any significant policy changes achieved through childhood cancer advocacy efforts that you've made over time? What has changed, and how much more could actually change?
Okay. Policies. Okay. The government side of view, right? We have the health insurance that we're really, really trying to push.
Okay.
Making sure children can get treatment, because as he said, it's very expensive. More can be done as regards policies. There are some countries where cancer treatment is free for children. They get everything they require, and then so those are the things we can actually imbibe here in the country. But the government is also doing their best, making sure children get into the emergency room without pain, and then there we can get them diagnosed early and all of that before they're moved into the ward. I don't know if you have.
We're having the conversation before this show that childhood cancer is, improving. Gradually, like what we've seen before. So now, one of the greatest policies that we've seen is the inclusion of childhood cancer in the National Cancer Control Plan in Nigeria, which is a major milestone. The one before the new control plan, it was not there, and thank goodness to the amazing work of pediatrician advocates
Yeah.
to get it there. And Nigeria is also, we've taken a step further and also trying to be on the WHO Global Initiative for Childhood Cancer Initiative, that's WHO GICC. Nigeria is on the process to be added as one of the GICC countries, and that is a milestone for the pediatric
Amazing.
oncology community. It's access to treatment, I mean, global advocacy, and we have so many um, partnership going on. I mean, with international partners to see to uplift childhood cancer. So, like I always said, we are not there yet, but the journey is the wagon is moving. The experience 5, 10 years ago
Yeah.
is different, like you said, and so but we will keep talking. Well, insurance too, I mean, it's part of, like you said, government. They are doing their best by, I mean, making these opportunities for us to be able to thrive in this field. But we are not there yet, but we are on the way better than we used to be before. So this partnership, I mean, for example, Nigerian Pediatric Oncology now has a better partnership with St. Jude Children's Hospital.
Okay.
For example, LUT is part of the Global Alliance, the St. Jude Global Alliance, and Dorcas Cancer Foundation is also part of it. So it gives us that opportunity for international partnership and to be able to get trainings, get development that could help the process of the work that we are doing. For example, to develop education of these professionals, even in times of radiation therapy, we started a program two years ago. We call it PDROC, that's Pediatric Radiation Oncology virtual course. It's a virtual course, and where that is leading to is fellowship opportunity for
Right.
pediatric oncologists in Nigeria. And what we are trying to do is, traveling in for trainings, and then so we are bringing in the experts and then connecting them with professionals in Nigeria. I mean, the first one we do, we just want to do something indoor, 30 people, and then fine, it's bringing to over 200 people.
Wow.
It was wow. It
Yeah.
was over a 2 day stretch. It was over. The last one we did on Wims Tumor, I mean, it's amazing. It's spike up, and we have a participant across sub-Saharan Africa. So for you to know that it's not just Nigeria that needs this. So in terms of policies, in terms of implementations, things are moving, but it can move faster.
Yeah,
Yeah,
especially
it
with
can-
training and
trainings,
retraining
yes,
and
it can move
retaining talent, retaining the doctors, retaining the trained doctors.
and
Yes.
that's why the PDROC program is
Yeah.
something that we are pushing into.
I was actually going to come to that
Mm.
because you mentioned training and education, and all I could think of was this one that doctors and Jackba are like hand in hand right now. I mean, doctors have left in
Yes.
such very, very large numbers. I mean,
Mhm.
how key is it that this ongoing training and education for healthcare workers in improving the childhood cancer outcomes for kids in Nigeria, it needs to keep on happening without stopping? Because
Yeah.
as it is, I'm pretty sure. I mean, from where you are sitting,
Mhm.
the manpower is not as strong as it
No,
should be.
no,
It's not,
So
not at all.
and
it's getting worse by the day.
and that's why I said at the
I hope
beginning
you're not
that
planning to jump.
like kudos to you guys for doing what it is that you do despite all the stretched resources and challenges and so on and so forth. Now this is one of them, but I mean, how can things be made better? What do you think could make this a whole lot easier, especially where childhood cancer care is concerned, because that is a major issue.
Yeah, it is. So as he said, the funding, the fact that I think there's only one center that offers radiotherapy.
Yes,
Um,
I mean,
I think so.
in
You
Lagos,
you
and
have
there are other private
private, yeah.
establishments
So
like
you
that.
have patients flying in from Abuja, from the north, coming for treatment here. Like I feel like if it's priority, you can have other institutions also equipped, empowered to, solve this problem. You understand? So yeah, there's a lot to be done, and retaining talent also is very important because people who are here are very passionate about Nigeria and Nigerian children, to be honest. Like, so just giving people incentives to stay, to improve, things in Nigeria, basically in the healthcare system and sector. So I think, yeah.
Yeah, like you said, I mean, I keep trying to say, okay, we are not there yet.
Mm-hmm.
Do you understand? I mean, things that everything she said, it's so much important. I mean, to retain
Mm-hmm.
talent in Nigeria,
Mm.
and I mean, creating conducive environment and
Mm-hmm.
everything, and that I would say, it's happening, but it's not something that would happen overnight.
Yeah,
That's
Takes
just it.
time.
Yeah, it
takes
takes
time.
time, and I keep saying it because being in this process for a couple of years and to what we've seen 7 10 years ago
Yes,
and what
better.
before now we have a facility, I mean one of the best facility in Lagos that treats childhood cancer.
Yes.
Yes, we have a good amazing ward that
Mm-hmm.
treats childhood cancer.
Yeah.
We have radiotherapy services
Yes.
in Lagos. They have access to it. So and that also, I mean, we have private organizations to that. So
Yeah.
it's not like that before,
Mm-hmm.
but now you can say, you can boast that we have amazing professionals, also
Yes.
amazing pediatric oncologists.
Yes.
Yes, there are few, they are not more, they are
Yes.
not much, they are over like 70 in the whole country. So
70.
yeah, so it's we want a lot, and
We want more.
that's why training, she mentioned about residency in pediatric oncology. That's why all these trainings, all this support that we are trying to bring from Dorcas is to just encourage these professionals, yeah, to stay. That's what I would
Yeah.
beg, to stay, and then we try as much as possible to see how we bring them opportunities
Mm-hmm.
and through the government support. And I tell you, the
Mm-hmm.
government of Nigeria is so much interested in childhood cancer.
Mm-hmm.
That's just reality. It's so much interested in childhood cancer, and
Nice.
yes, so much interested in it, and a lot is being done. And I would
Yes.
surface and Nigeria is in the global space of childhood cancer.
Yeah.
I can tell you in couple of, I mean, in 2 years we are hosting the World here for Childhood Cancer Congress. So we are
Amazing
hosting
stuff.
Africa, yes,
Oh,
in
wow.
Yes, we are.
2026. Yeah, South Africa. That's the International Society of Pediatric Oncology
Mm-hmm.
Congress, Africa, in Nigeria. So it's one of the leap
It
from that
is.
we've taken, and to
Mm-hmm.
and to have that in our country.
Mm-hmm.
It's going to pay more attention to the country, and so the work that Dorcas is doing
Yes,
and
they are
others are
actually
doing
doing
is,
amazing work. I have like personal patients that have benefited from it. It's amazing. Like honestly, you don't know how they're going to fund their treatment, and then the foundation is doing that. I just feel like it's amazing, amazing work. The impact in Nigerian children, it's not. We can't even start talking about it. Yeah.
These are the sort of feel good stories that we love to
Yeah.
hear. You know, not every time something happened and all
Yeah.
that. No, we need feel
There's
good
good.
stuff.
There's good
There's
in the
good.
country.
There's good in the country.
Yeah.
Definitely. Now talking about these patients, their parents, their families as well. I mean, those who are currently going through the journey of a
Mm-hmm.
child's cancer diagnosis, what
Mm-hmm.
advice or resources would you recommend to help them to navigate the very difficult time? Because I mean, I can't even remotely begin to imagine what a parent would
It's
be
going
going
through.
through to
Mm-hmm.
see their child in those throes of pain and discomforts dealing with
Yes.
childhood cancer. So, I
Yeah.
mean, what would you say to those parents and those families?
Mm-hmm.
What can make it easier for them?
Okay, so it's never easy. As a parent myself, I mean, it's really bad news when you know your child has childhood cancer. But just to know that it's curable, it's not a death sentence. I just feel like Nigerians should have a better outlook on things, better health seeking behavior, because we have a lot of patients who come in and then we tell them the diagnosis and then we don't see them anymore. They go to, I'm
Mm,
not saying going to church is bad, but we see people go to church and then people say, oh, just pray over it. And then you say, no, there's treatment for this. Nobody's saying you shouldn't pray, but do what you're supposed to do what is right. Like it's curable. A lot of children survive it. I feel like we should start having like support groups, like on our ward in Luth, we have parents who have gone through this and they are at the tail end of treatment. Talk to parents who are just beginning the journey. Like it
mm,
is doable, because cancer treatment sometimes takes 2 to 3 years, so we get really familiar with them, we encourage them and all of that. But just to tell Nigerians that it's happened, it had happened. We really don't know the cause most of the time. It's not your fault, because some people will start saying, "Oh, it's a family member, or it's from a wife or a father.
Village people.
There's no cancer in my family and all of that. So most of the time, like 90% of the time, it just happens spontaneously. It can happen to anybody. So it's not your fault. It's not anything you did wrong. It's not anything you gave your child to eat. Most of the time we don't just know what how it happened. But if you have a diagnosis like that, it's not the end of the world. You have people who have gone through it, you have people who have survived. And then another thing is that, oh, when you have a treatment, and when people say, oh, they can't treat you in Nigeria, and then try and go abroad, and then the time frame of trying to raise money to leave the country, things just deteriorate. We've seen it not 10 times, you see it over and over and over again. Like, they refuse treatment because they feel, oh, Nigerian hospitals can't deal with this problem, and then they waste time trying to get visas and all of that.
So they refuse treatment outright.
Yeah, some of them, because they don't believe in the Nigerian healthcare system. So you lose time, and then by the time they're coming back to us, it has spread. The child is really bad, and at that point there's really nothing. Even if you get to go abroad, there's nothing that can be done at that point. So my advice to Nigerians is that, please educate yourself, get the best care you can. Like, things are not perfect, but things are working. The Nigerian healthcare system has worked for some people. It can work for you too. You understand? So that's my advice. It's curable also, and things are getting better. Yes.
Thank you for that, Dr. Oladunni. Let's take one last quick breather here, and then we'll begin to, should I say, get into the tail end of the conversation this morning on Lagos Talks on Smooth 98.1. We'll be back in a bit.
This is IBK, and you're tuned into Smooth 98.1.
Wait, so people have that little faith. Well, some people have that little faith in the healthcare system and decide, I want to go abroad. Without even getting an opinion or anything. Just
it happens sometimes. They don't want to start that. If they start now, the child will die, and then we've seen a lot. I don't know if you know that too. Yeah.
That's people for you. I mean, the journey, I keep saying it. I mean, so many things. No, they don't know what those doctors don't know what to do. And one of the biggest problems with Nigeria is religion. Nigeria is a religious society. And you need to deal with that a lot, whereby letting people know that, look, pray for your doctor, pray for the chemotherapy
to work. Yeah, don't just leave.
Don't just leave, and don't just.
Even last month we had a patient, they didn't come back.
And families will say, you know what, it's the wife, it's the husband,
village people, and so on and so forth.
That village people is a lot, something I've done. Misconceptions, what did I eat, what did I, and this conversation becomes so tight because you can't say this is the cause of this thing.
That makes it even more hard.
That makes it even more harder.
All right, let's jump back in. Love music, love life, Smooth 98.1. If you're just tuning in, you are most welcome to Lagos Talks this Wednesday morning. Ayokunmi here with you. Alongside me are my very special guests in the studio as we're talking about Childhood Cancer Awareness Month and looking at childhood cancer as a national priority. Dr. Oladunni Okodugha and Korede Akindele. He's the programs director at the Dorcas Cancer Foundation. We have been sharing a lot of knowledge, a lot of value, opening eyes, and learning. Learning is something that does not end. It happens every single day. You can find knowledge in the most unusual places. Believe me, I've learned stuff that way. But anyways, welcome back to the conversation this morning. And we're getting to the tail end of our discussion, but I would really love to talk about survivors, because you alluded to it, Dr. Oladunni, about parents who have support groups in Luth, and they talk to parents who are just starting the journey, they counsel them, they give them hope, and so on and so forth. Now, what are the biggest challenges that childhood cancer survivors face after treatment? And is there any way you're helping to address these challenges? Okay. I'll come to both of you on this one, but I need Dr. Oladunni to jump on this one first.
Okay, so the challenge is obviously like children that are receiving chemotherapy, they can't go to school, so they lose school time. Sometimes they don't go to school for 2-3 years, so that's a problem. Financially, it drains their pockets. I mean, that happens everywhere in the world. But when health insurance is not a thing in a country, it's a problem. Like paying out of pocket for cancer treatments it's really really expensive. So that's why we appreciate people like the Dorcas Foundation that are doing an amazing job trying to fund. Then some parents lose their jobs because how do you explain to a private firm you're working at that you can't come to work for weeks or months? So people lose their jobs. It's a lot, honestly. And also the fact that even these children, that the treatment for cancer predisposes you to cancer in the future. So that's the health part. Yeah, so it can happen because of the type of treatment. So those are the challenges we have. But for how we try to mitigate, so as he said, in Luth we have a ward that we think is quite comfortable. We try to get teachers to come teach the children while they're on admission. They have a playroom, they have a reading room. As much as possible, try to make it home away from home, kind of comfortable, because they stay for weeks and months and all of that. We try to send letters to their workplaces telling them, and some workplaces actually try to fund also the relatives of these people. So those are the things that we try to do. Obviously, in follow-up, that's the medical point of view, we follow them up for life. So once you've been treated for cancer, you have to come for follow-up 6 monthly, yearly, just to make sure everything is fine, which is also very important, because some Nigerians, when they're done with treatment, they feel, oh, bye, that's it, never see you again, that kind of thing. But it's a lifelong thing. You have to keep checking up on them and all of that. Yeah.
Okay, yeah. I mean, survival. It's a critical thing, and this. I mean, for us, we have joy that we have survivors at Dorcas Cancer Foundation, and when we look at them every time, it's happy. So for to take care of your survival, like you said, I mean, they've lost school times, and we are grateful to people that support us in that project. We have a project that we've set up there for them. We call it Back to School. Okay, you've lost school, you're done with cancer, now it's back to school. We have like 7 children who are in school, courtesy from Dorcas Cancer Foundation. Some are on, I mean, we have like 4 that are on full tuition free, they're not paying tuition free, all through their tuition, 2 in the secondary now, and 1 in the primary. And we have 2
that is awesome.
That's awesome. So it's through our back to school program, that is what we are doing. And others that are on follow-up care through supply of school items and provisions. So now school is going to be resuming in September now, in the next couple of days. That program is ongoing. We're pushing it to see partners work with us on it, on getting this. So we are taking care of that with, I mean, for to get them back into school, and also for their parents, I mean caregivers, which has also gone through a lot, losing business, losing jobs. And so we have a caregivers forum to, if I ask what we are even doing with these caregivers forum, some of them, what they need is just putting their CVs together. That's what some of them need to be able to get, it's, I mean, to go through emotional. And so we have experts and say, you know what, for example, I can say, you know what, I can help, I can donate my time to help a father that has gone through these, put the systems together and get himself. You can give a business advice and say, you know what, when you do like this, to just, so that is what we are trying to do with the caregivers program for all our survivors. So for children, we're getting back, and we are setting process. In fact, one of the things we are doing for them, we have a project we're doing for our survivors this September. So just talked about everything she talked about, aftercare. So for the young adult and adolescent among them, talk about health issues, we talk about relationships. Just want to talk something different. It's just like an hangout that is going to come up. So just for them to feel that, okay, you're back into the system, because one of the things they are dealing with, stigmatization. It's dealing with them, it's eating them up. So that's what we are trying to do. And so even like you said, teachers coming, do you understand? For those that are currently ongoing to, because they are bright kids. I mean, if you see a child going through cancer, I mean, you will never believe that, wow, this child, if there is nothing has come up, or maybe there's no sign. So they are bright kids, and that's what we are doing. So because one of the things we are focusing on now is that survivors, to get them out and to get their voice, to get the stigmatization, and to let everyone know that that a child is going through cancer does not say the child cannot have life. It's not a death sentence. It's not I mean, it's not a communicable disease that
Yes.
okay, because no, it's not a communicable disease. They are normal child that has normal life, and if they've gone through it and they've survived it, they can do amazing. We have a lot of people doing amazing in the world, and they are survivors of childhood cancer.
That is absolutely fantastic to hear. We've come to the point where we need to land this plane, but before we actually do that, Dr. Oladunni, in about 20 seconds, any final words for all our listeners out there, and of course for those who are, living with this, and of course we want to share some knowledge as well, or some information with those that they know would definitely need it. Just in about 20 seconds, final words.
Final words, early detection is key in treating childhood cancers. If you want the best outcome, early detection. So if your child has recurrent fever, recurrent blood transfusions, those are like the common things, recurrent pain, and you don't know what's happening to your child, please go to a doctor, or yes, go to, and always have a second opinion. If you're going to a particular doctor and then they're saying it's malaria and typhoid and all of that, please, second opinion, go to a tertiary hospital where you can get a proper diagnosis for your child, because early detection is key in good outcome. Thank you.
Early detection is key in a good outcome, and that is a good place to actually park this plane in the hangar. But before we end the conversation, finally, Korede, I know that the Dorcas Foundation is on social media, and a lot of people would want to know more about what you do, and probably even get themselves involved, because you guys do really amazing stuff. So where can we find you on social media?
Okay, on social media, the Dorcas Cancer Foundation. Just type it there.
Simple.
And it's September. Let me just round it up. And when we have a challenge going on, it's Sing September, just to raise awareness for childhood cancer. And to get involved, just sing a nursery rhyme of your choice, a nursery rhyme, post it on social media, use hashtag Childhood Cancer Awareness Month, Sing September, and Children Are Gold, and tag the Dorcas Cancer Foundation. We'll say it's a nursery rhyme, just fantastic. To lend your voice to be part of this.
Okay, so anyone is open to actually this challenge.
Anyone,
grown-ups,
children, everyone.
Okay,
so even you hire, you're going to sing a nursery
I'm
rhyme.
telling you, I can't sing. What song do you want to sing now? Okay.
I would love to sing, but time is actually against us. But hey, that is an interesting thing. I need to get into the studio, get my voice working back, and all that. But thank you so much. Dr. Oladunni, are you on social media?
Yes.
Sharing knowledge here and there for those who would love to learn more and all that. I mean, where can we find you?
That's just my personal Instagram. I talk about pediatric things sometimes.
There we are.
So it's Oladunni. Yeah, I think _ Oladunni on Instagram.
All right, fantastic. Thank you so much, Korede, Akindele, and of course, Dr. Oladunni Okodugha, for joining me this morning to have this very, very interesting and important conversation as well. It's a pleasure, and I wish you guys all the best for the future in what you do.
Thank you for having us.
All right, Lagos, thank you so much for being a part of Lagos Talks this beautiful Wednesday morning. Smooth 98.1, you love music and we love life. It's going to be R&B soul music to settle you into your workday as you get along on a Wednesday morning.
Thank you so much.
Thank you.
Let's move on to sports. My singing voice is terrible. So I don't
like, nope.
No, I don't get involved.